అదేనా సరే సార్ మాట్లాడమే పేదల్ నర్సింగ్ స్టూడెంట్స్. So today's class, viewers, is on hypertension. Means many a times it is the essential hypertension. That is the primary hypertension, and you have the secondary hypertensions also. The primary hypertension is a chronic high blood pressure without a source of associated with any other disease. So most common form of hypertension is essential hypertension. The secondary hypertension is an elevation of blood pressure associated with another disease such as kidney disease, coarctation of aorta, diabetes mellitus, diabetic nephropathy, etc. The causes of essential hypertension. Mostly it is genetics, and some people are prone to develop hypertension and simply based of their genetic makeup. The family history will be present, and your risk for high blood pressure is present. The hypertension increases if it is in your family history. The environmental is inactivity and stress, obesity, alcohol intake, high sodium diet, tobacco use, age, and menopausal medications. So these are all the things which will precipitate to develop hypertension. Further complications of high blood pressure: thickening of the heart muscle, because the heart has to pump against the resistance, the left ventricular muscle gets up hypertrophied. Increased workload of the heart because of increased peripheral resistance of the vascular compartment. The left ventricle has to pump against the peripheral vascular resistance. It may lead to other conditions such as heart attack, that's myocardial infarction, stroke, or may lead to renal failure due to chronic glomerular sclerosis, or may lead to loss of vision because of high blood pressure, and increased incidence of retinopathy. Grades 3 and 4 may lead to a loss of vision. What is at risk? See, the African Americans have a higher risk of high blood pressure and hypertension. 40% of all African Americans in US will develop hypertension in comparison to 27% in a white population. 40% of African Americans, they have more predilection to essential hypertension than the US whites. This is due to African Americans respond differently to blood pressure medication. African Americans have a higher sensitivity to salt. So even up to a teaspoon of salt you can raise the blood pressure 5 millimeters of mercury. The signs and symptoms, they diagnosed through repeat blood pressure readings, and the signs and symptoms of blood pressure like dizziness, shortness of vision, shortness of breath, and the primary hypertension does not have symptoms other than high blood pressure. Usually they are asymptomatic. The secondary hypertension most likely caused by renal disorders. Symptoms you will see like decreased urine formation and like kidney disease, chronic or acute, or increased sodium and water retention is also present. The treatments, step 1, the lifestyle modifications. So the diet should be given, diet and exercise. The hypertension prevention diet should have low salt, less than 5 grams of salt per 24 hours, and exercise minimum of 30 to 40 minutes more walking exercise, bicycling or swimming will be more ideal to the patient. Limit alcohol and tobacco use. If you use alcohol, more alcohol in long way can prevent, it can develop hypertension. But if you limit alcohol, it's always helpful to control the hypertension. If you are a drunkard, better do not exceed more than 60 ml per day for males, 30 ml per day for females. So maybe ideal and best is to stop alcohol. And tobacco use should be curtailed or reduced, whatever it is. Stop the tobacco. Tobacco is a potent vascularite which will damage the endothelial system in the vascular compartment in the arterial system as well as venous system also, which will facilitate to develop atherosclerosis, arteriosclerosis, more common with the tobacco and alcohol. And to reduce stress factors, of course, everybody will have his or her own stress, which is very important. In decreasing the stress, one can relax, take rest, go for walking or swimming or do yoga, which is of great help in relieving tension, and thereby it can reduce the blood pressure by 5 to 8 millimeters of mercury. Step 2 is life changes are not enough. Drug therapy will be introduced. The patient's blood pressure does not come down to normal, that is 140 by 80 or 130 by 80, with lifestyle modifications, that is reduction of weight and changing dietary habits, going for a low fat diet, low carbohydrate diet. And if blood pressure still continues after 3 or 4 months of time of lifestyle modification, one should go ahead with drugs. We must introduce a drug of clinician's choice. Step 3 is if previous steps do not work, even after adding a drug, the blood pressure does not come down to normal, then drug dose has to be changed, and it should be increased to the maximum limit of that particular drug. And then if it does not work to bring down the blood pressure, to 130 by IT or 120 by IT, another drug can be added. Step 4 is more medications are added until blood pressure is controlled. So, first drug that is added to these patients, by and large, a long-acting diuretic like chlorthalidone, chlorthiazide group of drug. And if it has no much beneficial effect, because they produce kaliuresis, potassium loss in the urine, which can produce muscular pain and weakness. So then you can add ACE inhibitors, which are of great help. Usually the ACE inhibitors will be of great help to the patient to bring down the blood pressure, which brings down the tone of the efferent and arteriolar vessels. It increases glomerular pressure and increases glomerular filtration. So thereby, and it blocks the angiotensin converting enzyme inhibitor, which acts upon this angiotensinase enzyme, which blocks it. Thereby, the angiotensin 1 will not be converted to angiotensin 2, which helps in bringing down the blood pressure in these individuals, and which has also got a very good action over the left ventricle and right ventricle, which helps in modulating the muscular fibers of the heart. Thereby it helps in a remodeling of the heart. Thereby these heart size will not be increased in hypertension. Once the left ventricular hypertrophy starts regressing, so step 4 is more medications. Once you add one after the one medicine, exercise, one drug, no response, add another drug. You can give the third drug also. The more medications are added until the blood pressure is controlled. Up to 3 drugs or 4 drugs can be given, including a diuretic. In resistant hypertension, where the blood pressure could not be controlled despite giving 3 drugs, 4 drugs, 5 drugs also, where many a times the exact mechanism is very difficult to understand, and then you may have to try to explore and investigate for the secondary hypertension causes like pheochromocytoma, and where you have paroxysmal hypertension, so with profuse diaphoresis, that's sweating, and abdominal pain, giddiness, and sometimes they may develop even cerebrovascular accidents in the form of cerebral hemorrhage, or investigate for the kidney, investigations for kidney disease, complete urine exam, blood urea, blood sugar, serum creatinine levels, electrolytes, and ultrasonography abdomen in kidney disease, so to know the size of the kidney, which is very important, and iotography in coarctation of aorta. The prevention, the lifestyle changes If you do not want to get the hypertension, you have to adopt certain methods of lifestyle changes. If you are obese, bring down the weight to ideal body weight with plus or minus 5% to 10% of ideal body weight. Then start walking. So isometric exercises are of great help, like walking, cycling, swimming, and having regular checkups with your physician. So at least after the age of 40 years, every week one must check up the blood pressure with appropriate blood pressure cuff. So if you use so for an obese person, it may give a wrong reading. So usually an ideal adult, you must use a cuff of 13 by 25 centimeters in size. The cuff, 2/3 of the cuff should cover the brachial vessel, and it should be tied 5 centimeters above the cubital fossa, and recorded the blood pressure at least 2 to 3 times in your examination or consulting chamber, and take the record, average of it. That gives you a correct blood pressure. You have white coat hypertension. That is when you are examining the blood pressure in your clinic. Usually it is slightly higher, 5 to 10 millimeters, maybe higher. Or that is when a patient comes from his office who was put under stress for 6 to 8 hours in the office, comes to the doctor's chamber, gets examined, that is called white coat hypertension, and it should be examined for giving a best blood pressure recording. Ambulatory blood pressure is of great help to give a correct blood pressure examination, and that is 24 hours ambulatory blood pressure with the spikes of increased blood pressure during the REM sleep is of great help in giving a correct reading of hypertension. This whole term monitoring of blood pressure, that's ambulatory monitoring of blood pressure for 24 hours is of great help in deciding a patient having a hypertension, essential hypertension, and which may also detect if there are any arrhythmias, ectopics, atrial or ventricular ectopics. The arrhythmias also is mostly done for ectopics and supraventricular tachycardias, atrial flutter, etc. So then education, being aware of your blood pressure, where it should be, understanding your personal risk factors, so like smoking, drinking alcohol, and obesity. So these are all the things that should be kept in mind. Stop smoking, stop drinking is the best, and at least reduce their intensity, or even reduce the alcohol content, and understanding of all these personal risks and family tensions, economical problems, financial problems, etc. The engaging in community health awareness activities. So whenever there is a community health activity like camps or hypertension detection camps, one must be one must go to the camp and get the blood pressure checked frequently. Living with high blood pressure requires a lot of lifestyle change, diet as I told you, exercise, taking prescribed medications as required by your doctor, and the compliance of the patient, adherence of the patient to the drugs that is described by the doctor. So very, very essential. And recognize, and it is an ongoing process which requires regular checkups and taking medication regularly and checking blood pressure regularly is very, very important. And the dietary habits and salt intake has to be curtailed, and recognition and recognizing there can be complications with pregnancy and while living with a high blood pressure. The pregnancy all pregnancies should be subjected for examination of the blood pressure very carefully. If the blood pressure, the diastolic blood pressure, more than 85 millimeters of mercury, one should think that the patient is going to develop pregnancy-induced hypertension. And remember, the damage to the kidneys and other organs in mother and fetus has to be evaluated. By evaluating the patient blood urea, blood sugar estimation, and serum creatinine especially, in concern with the involvement of the kidneys and the mother and fetus health of the baby, and low birth weight of the baby should be taken into consideration, and whether the patient has any preeclampsia to be ruled out in these patients. The preeclampsia is diagnosed usually a preemie who is developing a high blood pressure, and albuminuria is mostly the diagnostic, and which will be usually resistant, and they may have develop convulsions or fits to these individuals. One should keep it in mind. So I will tell about how to record the blood pressure. The first thing, whenever a patient comes to your examination chamber or a consultation room, you ask the patient to wait outside for 5 minutes. And then the patient will be checked by medical attendant, and the patient weight has to be taken, and the blood pressure has to be recorded with appropriate BP cuff. Usually average BP cuff is about 12.5 by 25 centimeters or 13, whatever it is. And then 2/3 of the cuff should be wrapped medial to the upper arm, should occlude the brachial artery properly, and the cuff should be snugly fitting to the arm. There should not be any gap in between the arm and the cuff. And then and it should be wrapped smoothly without any folds, and at the same time the patient should not have heavy meal, should not have a smoke, should not have coffee, should not have tea, whatever it is, or a heavy ice cream, dessert. And then you should record the blood pressure 3 times in a period of 15 to 20 minutes time, and then you take the average of it. That will be an ideal blood pressure. And whenever you record the blood pressure, you must raise these blood pressure, systolic blood pressure above the normal of systolic blood pressure that you have recorded by palpatory method. At least 5 to 10 millimeters above the palpatory methods. Usually the blood pressure is 5 to 10 millimeters of mercury higher than the palpatory methods blood pressure, comparing with auscultatory blood pressure. And then you hear the blood pressure. They are the Korotkov sounds. Starts with Korotkov sounds, and they increase in intensity. More and more second type it increases. Third type it increases much more, and fourth type is slightly decreased, and fourth type decreased and muffled, and fifth type of Korotkov sound is at the level of disappearance of the Korotkov sounds. That is the diastolic pressure. The systolic pressure, when you start hearing the first Korotkov sounds, sometimes in essential hypertension you may have a silent gap. You will hear Korotkov sounds first and second, then again for some time it disappears. You will not hear anything. You may take it as diastolic blood pressure. That's wrong, and come down by every 2 millimeters of mercury, release down every 2 millimeters of mercury. And again the Korotkov sounds in the fourth phase, again it appears and then disappears in the fifth phase. So these are the Korotkov sounds that should be very cautious, and the personnel who are examining is also very, very essential very essential in recording the blood pressure. Sometimes there may be various errors by examining the blood pressure by a technician, by a nurse, or best is it should be done by a trained doctor. Is more ideal than just subjecting the patient to get checked by a paramedical staff. So this is very, very important. So then the treatment aspect that you know. So treatment aspect is, first thing is when you detect very first time the blood pressure, you ask the patient to change the lifestyle. If patient is obese, bring down the blood pressure, bring down the blood pressure. Okay, and if patient is obese, bring down the weight, and if patient is sedentary, ask the patient to start walking 30 to 40 minutes a day. At any time, whatever the time he gets, there is no bar for time. And next is, if there is no response, start one drug that is a diuretic, long-acting diuretic like chlorthalidone, which is potassium losing diuretic, which may produces side effects like muscle cramps and pains and muscle weakness. So that should be checked by doing a potassium level estimation in the blood. And second thing is, you can give an ACE inhibitor, which is of great help in bringing down blood pressure, which is a potent antihypertensive drug, and which has got so many beneficial effects. But one has to keep it in mind that patient, if he or she gets intractable cough, which is a common side effect, angioedema, giddiness, dizziness, one should stop ACE inhibitors and switch over to other drugs. So other drugs like beta blockers are of great help. The beta blockers should not be started early in all the patients of hypertension. The beta blockers should be given only with people with evidence of coronary artery disease. Evidence of coronary artery disease with myocardial infarction or ischemic heart disease or angina pectoris, beta blockers can be given safely, and preferably beta 1 and beta 2 blockers, or cardioselective blockers like carvedilol, nebivolol can be tried than atenolol and metoprolol in patients with the coronary artery disease. And then you have other antihypertensive drugs which can be given, like alpha methyl dopa, which is a centrally acting antihypertensive. She is the drug of choice, especially in pregnant, which can also be given other individuals. And clonidine and guanidine, which are also centrally acting antihypertensives, which are nowadays not very much used because of postural hypertension in those individuals. So various other drugs, ACE inhibitors like enalapril, perindopril and ramipril, all those drugs can be given in appropriate dosage. Enalapril up to 5 to 10 milligrams a day, and perindopril 10 to 20 milligrams, and ramipril up to 20 milligrams a day can be given. Beta blockers can be given to the maximum extent of the dosage. So this is how you should give the patient is very anxious and tense. Tranquilize the patient by giving 0.25 to 0.5 milligrams of alprazolam or any other benzodiazepine group of drugs can be tried to tranquilize the patient. The patient develops preeclampsia should be treated. Convulsion should be controlled by giving magnesium sulfate to those individuals. This is how you should control the blood pressure in these patients. skip button.